Welcome to the second part of Heart Health, folks of Tamizh Suvai Radio. We have Dr. Naras Bhat and Dr. Gautham Ramesh on our show. This is our session on the new year, 2024. A lot of discussions were made about heart health markers, anti-inflammatory, the statin drugs, and whatever is needed, the lifestyle changes that need to be marked, that needs to be done to make our heart healthy. Dr. Naras Bhat will proceed further about what needs to be done in a lifestyle to make our heart healthy, what diets to follow, what diets not to follow, etc. What is the medically that we can supplement ourselves to have an inflammation-free life, let's say, to some extent? Maybe we can proceed on those lines, Doctor.
Yes, so we listed the seven factor lifestyle modification. Of that, number one is the anti-inflammatory diet. Okay, the inflammation and anti-inflammatory diet is dependent on gut microbiome. Gut microbiome means they in our body, we have microorganism, which is called microbiome, and they are located all over our body, but specifically the food-induced changes in your gut. That is why it's called gut microbiome. And there are good gut microbiome and a bad gut microbiome. So your diet and lifestyle modifies your gut microbiome. Putting in a different way, your gut microbiome and your gut is the command center of inflammation in your body. And there is a gut-brain or brain-gut axis. Similarly, there is a gut-heart axis, gut-lung axis, and a gut-liver axis, gut-kidney axis, and a gut-skin axis, and so forth. So for your listeners, if you work like in the control center or the command center, and that is to work on your gut, and the major component there is two things about eating, what to eat and when to eat. So when I say what to eat, first thing, let's focus on what not to eat. Okay?
That's very important.
And what not to eat. It's a
Can
very
I
good
quickly go eat my last piece of samosa and come back?
Yes, indeed, but as long as it is cooked in the right kind of oil.
Right, yeah.
The samosa or any fried food, like egg roll or anything else, the cooking oil is the major component there, the pro-inflammatory cooking oil, which is called the omega-6 cooking oil, which we will elaborate on, which are the pro-inflammatory, the corn oil, the soybean oil, the safflower oil, the sunflower oil, and then these are the pro-inflammatory omega-6 oils, which we will elaborate later. Okay. But good that you asked. So your listeners have a little bit of connection to the samosa they are eating, or the vada in South India, the deep fried vada, that is similar to that. So what not to eat, let me list it.
I was told Gautam's patient loves vada.
He likes vada? All right. What kind of cooking oil?
Well, that I don't know, but my guess is most commonly like the vegetable oils that are sold in Costco, right? If there's any South Asian in the Bay Area, they're probably buying vegetable oil from Costco. So it'll be like, soybean oil, safflower oil, that sort of thing mixed in together.
Which is omega-6 oil. By the way, I may make a quick comment here. In India, the wealthy people, the richer the people are, they use the refined vegetable oil, which is called the safflower, sunflower, and all these omega-6 dominant oil, because that is the rich man's oil. The poor man's oil
palm oil.
Is what? Palm oil.
Yeah.
Palm oil is inflammation neutral because it is not omega-6 promoting.
Is that right?
That's right. And coconut oil is inflammation neutral. And we are from the omega-6 standpoint. And that is why, rich men in India, they have this what is called the refined vegetable oil as a marker of their wealth.
So you're telling me palm oil is actually good for health?
Comparatively, in that sense, it is
Okay.
saturated, but in the, ideally you should be on omega-3 oil. But if you want to bring an argument, the poor man's oil is better than the rich man's oil in that
Can I
sense.
ask you a simple question? What is the difference between omega-6 and omega-3?
Well, omega-6, your cell membrane in your body, including your heart, blood vessels, and any other cell, the cell membrane is composed of what is called the phospholipids, and that is made up of omega-3 and omega-6.
Okay.
When the omega-6 is dominant, the downstream cascade of the chemicals that is released, which become pro-inflammatory. When omega-3 is dominant, the downstream chemicals or messengers or cytokines that are released are anti-inflammatory. That is why there is a fight between the good and the bad, like Mahabharata Yuddha going on, between the omega-3 and omega-6.
Kurukshetra war, okay.
Kurukshetra war,
Okay.
And so you want to have more of the omega-3 and less of the omega-6, so your inflammation is balanced. To put that in perspective, in the Western culture that we live in, whether you are of an Indian ancestry or the white or black or Filipino living in America, they eat, which means we eat, 20 times 20 to 1. That is the 20 of omega-6 to 1 of omega-3. And the normal should be 1 to 3 or 3 to 1. 3 of omega-6 to 1 of omega-3. So we are 20 times more pro-inflammatory in our eating style because of the cooking oil. Additionally, most of the restaurants that our software engineers in Silicon Valley, most of them do not cook at home. They go out and eat in the restaurants, Indian restaurants included, and they are eating the omega-6 pro-inflammatory oil. And that is why, you can monitor it. By the way, if you could, just like you can do a blood test to diagnose somebody's diabetes, blood sugar as a monitor, similarly, you can do a blood test to monitor your omega-6 and omega-3 balance. That means it gives the backtrack of what you have eaten. And that test is called omega index test. The omega index test. And the test score should be closer to 10. Most people that I test, of Indian origin or otherwise, their index is 3 and the goal is 10. So you want to bring it up. How do you bring it up when we are discussing it? You bring it up by changing your cooking oil, number one, and you change the omega-6 to omega-3 dominant in place of the corn oil, soybean oil, safflower oil, sunflower oil, and you replace it with olive oil for sauteing, like sukha curry, what do you say in Tamil for sukha curry? Poriyal?
Dry sabjis, yeah.
Dry sabji. And then for deep frying, if you do, then you use avocado oil or coconut oil, or why? Because their smoking point is high. That way the food does not get oxidized and become trans fat. Secondly, the oil itself is omega-3 dominant as opposed to omega-6 dominant. Okay.
So again, related to the same topic, I do see when I walk into any drugstore, I do see omega-3 supplements, fish, whatever the small omega-3 supplements. Is that safe to take?
Yes, omega-3 supplements come as vegan as well, or fish derived, okay, which is called marine. Okay, so people who are total vegans, they can get EPA and DHA of vegan source as a supplement in the American market.
Very
Okay.
nice. Very nice.
And it is non-prescription. And
Okay.
people who can consume fish, you know, or fish supplement for that matter, they can buy EPA DHA combined fish oil capsules.
Okay.
But the supplement still is not the final solution. You need to go to the root cause of your cooking oil.
Got it. Got it.
Okay.
Along the same lines, the second part of my question was you talked about oils, different types of oils, omega-6, omega-3 oils. What's your take on ghee, doctor?
Ghee, which is the purified butter,
Yeah.
is omega-6 neutral, period. That means it is not pro-inflammatory because it is not omega-6 dominant.
Huh.
Having said that, a lot of ghee or a lot of butter is pro-inflammatory. Up to 10% of your fat intake can be butter. Most people, use the butter 1 or 2 teaspoon or a tablespoon a day or not more. For that reason, any dietary recommendation anywhere in the world allows you 10% of your food as a saturated fat. If you choose that as a ghee, you have made the best choice.
Got it.
Okay.
Only
And now,
10%.
and we don't, if you unless you eat a lot of, one day you might indulge in eating some sweets made in sea with the ghee, but that's okay for that day. But consistently doing it is not that good,
Got it.
And
Got it.
I grew up in South India, we used to have 2 teaspoons of ghee with rice, with each meal, which is just right. 1 or 2 teaspoons. Okay.
Yeah, thank you.
Now, if I may go into what not to eat for your audience. Okay. Number 1 focus on what not to eat is the processed food, period.
Okay.
Processed food is what is not native, like in the old world in India as well as here, we used to have whole grains. Now we do not eat whole grains. We eat the processed atta, processed grain, which is pulverized whole grain and part of the nutrient taken out. Why? To increase the shelf life. And so that the bugs don't grow in the powder. Okay. So unprocessed, unrefined carbohydrate is also having the quality of resistant starch. That is called the MAC, microbial accessible carbohydrate. And that is why the unprocessed whole grain like rice, wheat, or any other like corn, or whatever whole grain you use is fine. Okay. Because it's microbial accessible to feed we call it to feed and eat. If you divide your plate into 2, the first part of your plate should be to feed your gut bacteria, and then the easiest way to feed your gut bacteria is to beans and lentils. Beans and lentils. All over the world, people use beans and lentils. Like in South American culture, they use black beans. The Mexican culture, they use a lot of beans, black beans most commonly. In Indian culture, dal, lentils, okay? And then chana dal, very common all over. And so why? Because the beans and lentils provide the resistant starch to feed your gut bacteria, and your gut bacteria produce short chain fatty acid inside the gut, and that is anti-inflammatory, and that even counters the inflammation you may produce by eating wrong food like animal food. Having said that, let me focus very precisely on animal food. Animal protein changes the gut bacteria towards inflammation, period. New research just published last month tells that is the reason vegan diet is a curative for inflammation.
Okay.
Why? Because the protein source from the vegan, that the plant-based proteins are anti-inflammatory. Having said that, if you have a small amount of animal protein on your plate, if you have a large amount of plant protein and polyphenols, the coloring agents in the plants, like fruits and vegetables, and beans and lentils, which are the resistant starch, if you have half of the plate with this anti-inflammatory food, the other half, even if you indulge a little bit into pro-inflammatory food, you are having one up on the anti-inflammatory power. Clear?
Yes, absolutely. For your information, Dr. Gautham is a vegan.
Gautam, and the patient that you presented was vegan?
Vegetarian.
Vegetarian, okay. But, he loved that cooking oil, right?
Yeah, probably. I mean, I think the advice you're giving in terms of, trying to switch out some of the animal proteins for plant proteins, that's like kind of the golden bullet or silver bullet, because not only do you, if for example, you take chana and you replace whatever animal protein you're eating with chana, not only are you decreasing the pro-inflammatory components of the animal protein, but even, what is it, like 1 cup of chana has 15 to 20 grams of protein, 15 to 20 grams of fiber, which is like half your daily fiber, 1/3 of your daily protein, and fiber is one of the, I think 99% of Americans don't get the daily required amount of fiber. And so with one garbanzo bean, you get 2 mangas.
Excellent point, Gautam. Let me elaborate on one particular word he used, 1 cup. Okay. When we say you should consume beans and lentils, many people say we cook beans and lentils all the time in our house, but each individual gets only 1 or 2 tablespoons worth of beans and lentils. But you should consume 1 full cup per person of beans and lentils, and that is the therapeutic dose of MAC, called microbial accessible carbohydrate, and you mentioned that accurately. Okay,
Great
because
point.
that's the clarity. That's the clarity. You must consume. And having said that, Dr. Gautam, most of my patients say that gives me gas. Okay, then what I tell them is, of course, every man and a woman should pass gas. If they stop doing so, then we have to operate, and because they have intestinal obstruction. Agreed?
Also,
And
I think
moreover,
people just aren't used to the amount of fiber that they actually need. And so by slowly working up to that amount, then you won't be as discomforted by that gas.
and also with the time, your enzymes learns to digest it.
Mm-hmm.
Okay, and then I mean, this is a humor, the medical humor. The old people say, beans gives me a lot of gas. I tell them the best thing to do is what is the opposite of old fart, and it is not young fart, it is the new fart, and that you get it by eating these beans and lentils.
And your gut microbiome will also slowly adjust to what you're eating, because what you feed is what will grow certain colonies of bacteria and downregulate other colonies of bacteria. So the better you eat for a longer period of time, you're kind of cultivating the good bacteria in your gut as well.
Absolutely so. Absolutely so. And you very well said. So should we go into the couple of other points then?
Yes, please.
Okay. Now, we talked about the anti-inflammatory diet, that is what to eat and what not to eat. And then they basically, to recap, what not to eat is processed food, particularly processed sugar, and then try to reduce the animal protein and animal fat, and increase the plant-based, plant-centered, whole grain. That is what to eat. And then fasting, which is really the 16-8 fasting is what we recommend. That is, if at all possible, that you have your dinner at 8 p.m. if possible. Next morning, instead of breakfast, you can have a fasting mimicking diet. That is a vegan fat like avocado or MCT powder and medium chain triglyceride powder or oil. Why? Because that is the avocado or MCT powder or coconut oil, these are ketogenic, meaning thereby they produce nutritional ketosis that gives you a microbiome altering fasting effect, and that is called fasting mimicking diet. It is a $36 million research funded by NIH, research done at USC near Los Angeles, and that is led by Walter Longo, and that is called the fasting mimicking diet or prolonged diet, which you can mimic by doing a ketogenic breakfast, and or you can skip the entire breakfast and eat your lunch at noon. And then why? Here is the major point. When you skip and do the fasting, or this one, the fasting mimicking diet, the postprandial or after eating metabolic endotoxemia called ME, that one is reduced and countered. That is the pivoting or the major factor in reducing insulin resistance, and insulin resistance and circulating insulin is a major inflammation producing factor in our body. And that is especially people who claim they are vegan or vegetarian, who indulge in processed carbohydrate that is inducing metabolic endotoxemia and inducing inflammation. So your patient that you presented, the 59-year-old man who had a heart attack, he is a vegetarian or mostly vegan vegetarian, and then must be eating processed food and eating 3 times a day or 4 times a day, and then not fasting. Was he fasting, Dr. Gautam?
No.
No. If that patient, let's assume, did the 16-8 fasting, he is reducing it to his metabolic endotoxemia, the pro-inflammatory toxins that is released by the processed food. How and why? The processed food releases pro-inflammatory cytokines and does not induce the short-chain fatty acid, which is like butyric acid, propionic acid, or acetic acid, called short-chain fatty acid. For you, Dr. Gautam is a new doctor. So this is the logic of intermittent fasting. Okay? Now, easily doable because, the ketogenic breakfast, the fasting mimicking, controls your hunger and controls, for your information, the GLP-1 activator. In America today, the Ozempic and so many other medications that are used, to reduce weight and counter diabetes, and this is the natural way to activate your GLP-1, the beans and lentils, as well as the fasting mimicking diet that we talked about.
Doctor,
MCT.
back to the MCP oil that does the mimicking of fasting. Could you throw a light on where to buy it, how do we consume it, etc.?
Yeah, MCT oil in this country, in the United States, MCT oil is a medium chain triglyceride derived from coconut or palm oil, is commercially easily available.
Okay.
In India, in major cities like Mumbai and Bangalore, It is available, but expensive because it is fractionated. Coconut oil can replace it. To clarify, coconut oil has 3 components: lauric acid, capric acid, and caprylic acid. Lauric acid is carbon 12, and capric acid is carbon 10, and caprylic acid carbon 8. The MCT primarily refers to these 3 items, that is and C8, 10, and then 12.
Complex
and 12 and more is more saturated. So coconut oil gives you at least 50% of coconut oil is MCT. For that reason, poor man's MCT in India is coconut oil. Use a tablespoon or 2 in the morning as a part of your breakfast, and and then that itself is going to induce some level of MCT effect for you to modify gut bacteria, and also giving you the fasting and mimicking value of the 16-8 fasting regime. Okay?
Excellent.
And then one part I think your audience may want to know, because everybody wants a pill. Is there a pill to reduce inflammation?
Yes.
Is there a magic pill? And let me answer that question. Answer is yes, and definite yes. In 2024, as we are now, inflammation is now 1-to-3 proportion. That means 3 cardiac events that happens that brings a patient to the hospital is the inflammation focused, and 1 is the original cholesterol focused. So 3 times as many heart attacks occur due to the residual risk of inflammation. Paul Ridker from Boston is a major researcher who is a proponent of this new scientific fact. Now, having said that, colchicine is a good old anti-inflammatory drug used for treating gout, which has become available as an approved, FDA-approved treatment for reducing your hsCRP and other inflammation markers. And it is very inexpensive all over the world, and its value is you can call it as a new aspirin for heart disease if the inflammation is a major factor. Okay, so
what's the difference
hsCRP.
between aspirin and this?
Why the aspirin?
Aspirin
One
is also an anti-inflammatory, right?
Yes, indeed. Aspirin is anti-inflammatory to an extent, which is called a NSAID, non-steroidal anti-inflammatory agent. And however, aspirin also has the risk of bleeding and everything. And then recently, in the last few years, for older people, aspirin has been, a double-edged sword, like a sharp knife. It can cut you, it can save you, it can bleed you. And that's why it is not routinely used. And colchicine, the new recommendation is you use it for cardiovascular inflammation when the hsCRP is high. And that was first approved in Europe, and now it is approved in the United States. And I usually say the sun rises first in the east, So that's in Europe, it was approved in the European College of Cardiology and so forth. And so we covered that one. And then if we want to wrap up, here is what I would say, one sentence, if I have to say to a patient, a cardiac patient or even otherwise, is know your numbers. Everybody is focusing on stepping on a weighing machine and knowing their weight. And here, something beyond checking your weight. Check your blood pressure. They get a home blood pressure device. What and get the heart scan to see your calcium score to determine whether you have coronary artery disease or not. And the blood test, here are the ones for your listeners. Number one, for people of Indian origin, get a LP little a test at least one time in your life. If anybody is high in your family, get the whole family tested. The next blood test you focus on is LDL particle number or ApoB. And then the next one is the anti-inflammatory power of your blood system, which is called the omega index test to determine how much of omega-3, omega-6 imbalance you have. And then finally, the inflammation markers, which is HSCRP, the LPPLA2, and the MPO. And do not forget about HbA1c, hemoglobin A1c, which is the pre-diabetes and diabetes marker. So these are the repeat. Once again, I repeat, your mantra should be know your numbers. And what are those numbers? Not just your weight, your blood pressure, and the blood test that I mentioned. If you do so, even if you, here is my teaching, that is, coronary artery disease is a marker for aging, just like the graying of your hair. Nobody dies of gray hair. Gautham, you don't have any gray hair. Okay. But nobody dies of gray hair. It is a marker of aging. Coronary artery disease is a marker of aging. The inflammation is the one that produces the cardiac event. And if you counter the inflammation, if you track it, you will die. Everybody dies one day, but you will die with the heart disease, not from the heart disease. That is my message.
Thank you very much, Dr. Bhatt, and wonderful messages for the new year to start with. Wonderful, heartful messages for the new year to start with. Very enlightened. I learned a lot in this 2 sessions of 40 minutes each. And thank you, Dr. Gautham. Wish you great success. I'm sure you too had a lot of things to learn from Dr. Bhatt, just like me. I had to start from scratch. And for you, your level starting level was a little higher, I'm sure, than where I started from. Thank you again, both of you. Have a great and healthy year ahead.
Thank you.
Dr. Gautham, looks like you are a musician and you have a lot of music behind you there. Is that right? Are you a musician?
That's how I keep my blood pressure down.
Hope I have contributed some additional music to your ears.
Oh, yes.
Definitely, of course.
Oh, yes. Oh, yes. Thank you so much again.
Thank you both, and enjoyed the interaction.
Same here. Thank you so much.
All the best for both of you.
Thank you very much.
Thank you.